Today, the American Cancer Society is launching its largest study of cancer risk and outcomes for Black women. And we're checking back in right now with Carolyn Murray, who is live for us at the Hope Lodge in Charleston with much more on the study. Hi, Carolyn.
Hannah, thank you. Yes, and that is because the numbers are simply alarming. Black women are less likely to receive a cancer diagnosis, but if they do, they are less likely to survive it. I am joined by Monifa Ellington. She is an ambassador in the Voices of Black Women campaign. This is a 30-year study that promises to reveal information about why there are so many disparities when it comes to Black women and their outcome after receiving a cancer diagnosis. Monifa, thank you so much for being here, and we understand that you are one of many ambassadors. This study, as you well know, promises to bring together some 100,000 Black women in some 20 states in this country. We are hoping that at least 1,000 women in Charleston will participate, and you are among those who has already answered the call. Why do you believe it's important to be a part of the Voices of Black Women study?
I think it's important really because there is such a large gap when you see the data for Black women that have been impacted by cancer and how they are twice as likely to die from cancer if they're below that age of 50 compared to white women and any other minority group. And that just really touched me when I heard those numbers. Of course, I'm a Black woman. I have a daughter, and I have a grandmother who also was impacted by breast cancer. And to hear that there are so many inequities with the information needed to understand the why we're being impacted in the way that we are made me feel compelled to just get out there and do something to help figure it out. And so taking the survey only took a little bit of my time out of my day. And if that's the one thing I can do to help others not be impacted by cancer, that's what I need to do.
You're a professional woman. As you said, you're a mom doing a lot of very busy things, as most of us are. So walk us through going through that survey. You said it took, you decided how long you would spend each day. It takes about 90 minutes. And also give us an idea of some of the questions that were asked in the survey.
Yeah, so the process was pretty simple. It's 90 minutes, it says maximum to take it, but it does allow you to pause and take breaks in between if needed. So I probably went 3-4 different times back into the survey to complete it. Once I was able to get in the survey and start answering some of the questions, it asks about our lifestyle. It asks about your medical issues that you may have experienced in the past or present. It asks about whether or not you are active, healthy, lifestyle when you're, exercising, things of that nature. It really goes in depth with quite a few questions to truly understand the medications you're taking and things you're doing on a day-to-day basis that may or may not impact you having cancer versus, like I said, counterparts of another race.
Sometimes people are reluctant to put information into computers. They might feel like it's intrusive. But you were explaining, Monifa, that you felt compelled to do this because it's very important. You have a daughter. She may have children. This is the only way to really understand how to treat cancer and why there are such disparities is to be able to willingly share this information.
I totally agree. If we are seeing that there's an issue in our community and we are sitting back not taking the bull by the horns and doing something to make a difference so that our children, our grandchildren don't have to experience the things that we and our ancestors have, why wouldn't we want to do it? This is something that is so easy. You don't have to go in and do any physical tests. You don't have to drive anywhere to participate. It's just a matter of pulling out your cell phone or your computer and just taking the time to answer the questions that are being asked in the survey so that that data can be collected. We're trying to collect information from 100,000 Black women throughout the United States between the ages of 25 and 55. It's only a matter of time before we're going to hit that goal of getting all of the people that we need to complete the survey. But it's very easy to be able to go in and just answer the questions needed. And like I said, it allows you to pause, come back as needed to be able to answer those questions, break it up as much as you needed to be able to complete the survey.
And this is a very long process. The study actually is over a period of 30 years, but in terms of your actual time, it's only twice a year that you would be asked to submit this information.
That's so correct. So the first time initially, it would take between 60 to 90 minutes to be able to complete the survey. Annually, you only need to go in 2 times a year. maximum of 30 minutes each time. And that maximum of 30 minutes is really only dependent upon whether or not you have changes in your lifestyle or in your health history that you need to go in and update in the system. So you might be able to get in there and knock that information out in 5 to 10 minutes, possibly. So,
and one of your other commitments is reaching out into your own respective communities, your places of faith, places where you work out to encourage people who are in that same age group between 25 and 55. You're actually being an ambassador for the American Cancer Society.
I am. Like I said, I feel like it's my obligation. I've seen that, my grandmother, I just cared for a father who passed away from cancer. This is a nasty disease that I want to see go away. So look out in Jeopardy. I'm going to be reaching out to my colleagues, my church members, everyone. I'm going to be coming for you to complete this survey and help out in any way that we can.
All right. Monifa Ellington, thank you so much for sharing your story, and thank you for sharing your commitment. And again, we are talking more about this 30-year study authored by the American Cancer Society, Voices of Black Women, looking at why there are cancer disparities and what the American Cancer Society and what you can do to change it. Stay with us. We are coming right back with more news. Reporting from Hope Lodge, Charleston, I'm Carolyn Murray.